Okay, guys, we're now in the office today. Today is the October, believe it or not, the 3rd. We're getting ready to get a patient numbed up. She's having a 360 lipo. You see, I've already gotten started, actually. I want you to just experience this with us. So I'm just numbing her up. And the speed of this infiltration is 260 cc's or mLs per minute. This is number up, so she'll get nice and big and firm from this. But it's important to get the tissues hard and firm so she can have a very nice, pleasant melt down and suction out. We're gonna be using the VASER 2.0 over here, which is a way in which we ultrasonically melt the fat. So I'm just going up here now. Notice how I'm just grabbing and squeezing. You notice how comfortable she is? She may have like a little pinch thing from time to time, but she's absolutely marvelous. So this is called infiltration with the Tumescent technique, moving, fanning, stand on plane. I usually try to get the deeper area first, which is not deep, but it's above the fascia of the muscles above it, and below it rather, and that's gonna be the rectus muscle, okay? So as long as you got the machine going, your doctor need to be moving. Go right up to her apex here. Right here is the xiphoid process. Take it right up to the xiphoid process. Being careful not to go underneath that. If I do, I'm underneath the ribcage, and I'll be into the diaphragm, the breathing muscle. She's been a very good patient. How you doing, love? How you doing? How you doing? How you doing? How you doing? Smile for me. How you doing? Can I get a thumbs up? Okay. Well, because don't do that or whatever. But this just to let you know that this is happening now. Real time, it's, I want to say it's 1:48 in the afternoon. Again, this is on October the 3rd, which is a Friday. I'm a very happy guy because my Yankees won. They beat people I don't necessarily like, which is Boston, the Red Sox. They did it very handily. So this is just the infiltration part. Notice there's some blanching of the skin, which gets a little pale. That's very good because that means that I have numbed up just below the reticular dermis, which I'll be in that area, tightening that skin up as we do what we're doing. So again, this is called VASER, lipolysis, as well as some tissue tightening. So I'm gonna come over on this side. I'm gonna work to the side now. Do the same little tiny incision. Moving, fanning, stand on plane. You're doing absolutely marvelous. Yeah, we've used up 871 cc so far. So this is the lower abs, upper abs, which is cold to the touch now because of the constriction of the epinephrine that's in the tumescent fluid. In the tumescent fluid are 4 things. Lidocaine, 2%. We put in bicarb, which is 8.5%. We put in epinephrine, 1 to 1,000, which makes it 1 to 1,000,000 because it's in 1,000 cc's of normal saline. And we put in also Cannula, 10 milligrams of that. That tends to decrease scarring, especially in people of color. So basically, that's pretty much it for how we do the infiltration. Okay, guys, so now we're back, same patient. I'm gonna show you how I make my little incisions. I wanna make sure they're in the lingular lines, which is the skin lines, how the skin flows naturally. So we're gonna put one towards hip here. This is like holding a pencil. So I'm not taking it all the way in, just a small amount. And over here. You're absolutely marvelous, my kind lady. You're doing great. My goodness. So that gives me access to go from here up to the armpit here, down here a little bit. I can go here into the backside, which is over here and over here. So let me show you what's going to happen. Let me just grab my infiltration needle real quickly. And I'll proceed. So, again, I'm gonna go this way first, back into the waist a little bit. Get a little bit of tissue here. She may ooze a little bit, which is very normal. Her last blood pressure was 132 over, what was that? 132 over 70, 80 something, what was it? 133 over 80. We're gonna continue now with the infiltration. Needle in like so, we're in. Now we're gonna number up again. You're doing absolutely marvelous. My goodness, best patient all day. In fact, the only patient all day so far. Nice and easy, you're doing great. Been absolutely marvelous, my goodness. Good God, woman. Boy, you're a tough one. I'm gonna go down to the back area. This way from here. Right there is perfect. Again, close to the entry point, so I have control over the needle. You see it's a blunt needle, so it's not gonna cause any real harm, but it's just good technique to follow where you're going. You can see here, I'm going all the way to that point there. See that bulge there? That's where I'm gonna be ending up with that area there, numbing it up. Again, she'll have a total of 2, 4, 6 incisions only. We're gonna extend ourselves. You're doing great, love. You're doing absolutely marvelous. My goodness. You're doing so good. I'm so proud of you. Good God, woman. I want you to bend down this way. There you go. Thank you. She is totally with the program. She's moving for me as I wanted to move, which is very important. Down to this one little area here. Doing absolutely marvelous. Good for you. I'll make sure I get the skin underneath the skin very well. Now, relax a little bit. You're doing absolutely great, love. So I'm gonna come this way. I'm gonna get this area here. So I want you to bring this arm down for me a little bit. That's good, right. Oh, beautiful, beautiful, beautiful. I can get this little fat pad here. She doesn't like that. Just when she put on the bra, whatever, that kind of like sticks out. We're in that area. And as long as you're working parallel to what's below it, you can never hit anything, which is good. You're doing absolutely marvelous. Moving, fancy, and playing. Doing super, super, super good for you. Off, pause. So I'm gonna tilt the needle just a little bit. It's the beauty of a needle, you can bend a little bit. Fingers got a little moist with the gloves. There we go. Never force the needle, just go back. Make sure you're in the right plane and make your corrections. So I'm just above the scapula, the posterior angle of the scapula actually, and this side is pretty much done. Now you guys probably should notice I have one little segment here to do, and then we'll be done for this side. And we should have just enough. This way from your love. Good, good, good. Okay. You want to come from the other over here for something? I don't know. If it's good away, it's good. Okay. Back into one corner here. Doing absolutely marvelous. My goodness. Good, good for you. Really. Last little corner here. Right here. So let's look for me, love. That's beautiful. She's totally awake, guys. She's doing absolutely marvelous. So this is now all Tumescent. hard and firm. I'm gonna give her a really nice back line. Get rid of some of these back folds that she had. So that's that with that, that's good with that. Maybe a little bit more up here. Give it a silent prayer. You can stand, either way you want to stand is fine. You can go ahead. So I always open up in a little silent prayer. Everybody knows that. So let me have a little pause here. Get a good Lord glory and praise. So I've already put in the skin guards. Been switching them, we take those out obviously shortly after we get done. Here's a little noise here. And she's totally numb. Here we go. So this is the meltdown. This is VASER lipolysis. I keep moving, fanning, stand on plane. Remember, I numbed up from the deep to superficial. So this is a really sweet thing here to do. See what it looks like. It looks like that, guys. So this is a probe, it's a 2.9 ring probe. It has 5 rings, very explosive. The reason why we make sure that we have them Tumescent hard and firm because it makes the sound waves just boom, explode. That's what it's all about. See already it's gonna come out? That's coming out already. It's gonna come out as a liquid. So now I'm back in doing my thing. How you doing, love? How you doing? How you doing? I can't hear you. How you doing? Talk up to me.
I'm good.
You're good? Okay, you good, I'm good. All right, that's good. Moving, fanning, stand on plane. Now I'm gonna get right next underneath the skin, but you notice I'm gonna do a splay pattern. I wanna be able to break that fat away from the reticular dermis. That's gonna make that skin tighten up. And heat, I should say collagen loves heat. And that's what makes them tighten up after this is done. We do high definition work with the same instrument. It's the technique in which we do it. So moving, fanning, stand on plane. And we're gonna do this section first. Then I'm gonna move to the next section, show you how that's done up top. Then the waistline, and then we'll let Christine stop, and next time you see me come back, it's gonna be suctioning out the fat. You may see the fat running out over here. So now I've already moved up to the top here. But you know this technique is to lift. And as long as I lift and stay on plane, I will hit nothing below it. And that's the key to doing this. So I'm right straight in here now. I'm lifting up. I'm gonna stop for a minute. That's where the probe is, right here. And if I go ahead a little further up, give it a little gas, break that fibrous tissue. Okay, now I'm right here. I don't know if you see it or not, Chris, but it's poking right there. So I can cover from here all the way up here, over there, and over here too. But again, it's so important for the doctor to talk to patients as they are awake, let them know what we're doing. So we're moving, fanning, stand on plane. She's doing absolutely marvelous. And this 5-ring probe is simply marvelous. Because I'm not just jerking, I'm just moving. Nice strokes. This is the VASERs at 90% of the intensity. I don't know if Christine can get the VASER unit on. It shows the intensity of what we're doing at 90%. When I'm teaching and training, it's either 70% or 80% as they get better. So, this part here is almost done. Again, I'm gonna spray the skin, take it right underneath the bottom to separate that fat from the reticular dermis. That makes a huge difference in how they look afterwards, because it really does a beautiful job in doing that. So she should get relatively flat. No reason why she cannot. I did a little ultrasound prior to even working on her of the abdominal area to make sure there was no, I think like a little hernia there. She has nothing there at all. So this is kind of like pretty cool. As long as we stay parallel to what's below it, then we're good. Now I'm gonna move now here in a moment to the waistline area from this one incision here, from right here. I'm gonna move over that side. You're doing great, love. Maybe you should be over here still. Now I'm gonna work on the side over here. Nice, look at all that fat. Well, fluid there too now. I'm gonna just go keep moving, fantasy and on plane. Whenever I stop moving, my hand's off the gas. When I'm ready to go, this sound, hand is on. Foot is on the foot pedal is on the, I call it the gas pedal, which is basically the pedal, so I can continue on with my process of doing VASER lipolysis. And this is 90%, which is, to me, it's very efficient for me. Others starting out 70 to 80% is probably where you should be with the intensity. That's the aggressiveness of the probe itself. And keep in mind, again, the 5-ring probe is very aggressive in terms of the meltdown. The skin guard is there for 2 reasons. One, when I pull out, if I pull out too early, the skin guard really protects the actual skin. When I'm suctioning, I'll use this, keep the skin guard in too, just to make sure you don't get any friction burns. The people of color that get friction burns, they're a little upset by that because it looks like they have a black spot there. So you have to be very cognizant in working with anyone of color, including my Mediterranean Anglo patients, especially those that are from Italy. Okay, Chris, so you get a chance, guys, to see me do this portion. When you come back, I'll be suctioning out these same areas, okay? Hope that it was very informative. So now I'm suctioning. Starting from the patient's base here. And you'll see the fat come out a little bit. Maybe a little tinge of blood, which is very normal. Tumescent fluid action. Again, moving fantasy and on plane. Make sure you get me and everybody else in the whole picture, because you don't have to just get just a tube. How you doing, love? Doing all right? I didn't hear you. Yeah. Good for you. I am too. So now I'm in the upper part of the abdomen here. Again, staying on plane. Parallel to what's below, so I can never hit what's underneath it, which is good. It's always a good thing. Moving fanny channel plane. And this fat, by the way, guys, is all melted fat. And that's what it kind of looks like. So I'm going to go here. There's where my probe is right there. So I'm up just above the xiphoid process, lower part of the chest wall, not underneath it. Underneath the ribs would be a real problem. That could lead to going into the diaphragm. That could lead to pneumothorax. Then I have to put my other certification in process, which is called emergency medicine. So you don't want to do that. I just saw a patient this too. God may have sent you to go see me, but not for me to go send you to see him. Amen. It's just a real smooth process. Nothing tough about it. Once you got it melted down. It's coming up here pretty nice, actually. I'm going to show you something, and I'm getting a waistline here in a minute. So I'm going to give you just a few minutes of how this process works. I'm going to work over here, so it's going down over the side, but watch this. I'm into the waistline here. Now, typically the fat will kind of like move into the gutters. So you're going to see maybe a little bit more fat and fluid coming out of the side here because of the way in which the fluid will lay out into the gutters, which is the waistline area. Notice I'm not looking at the tubing, don't need to. My focus is on sculpting. I want to make sure we give her a really nice, tight-looking waistline that the sister deserves. Ah. You sure do? You deserve that tight waistline? Mm-hmm, says the young lady.
Milk jug.
Huh?
Shit, like a milk jug.
Like who, Doug?
A milk jug.
Like a milk jug.
jug.
Oh, jug, like, oh Lord, like a milk jug. Holy mackerel, Andy. Holy mackerel, Andy.
Circles and stuff.
You're doing absolutely marvelous. She's pretty much wide awake. She's talking to me, having a good time here. I'm glad this is working out for you really nice. I feel good about this. You're welcome, love.
I got that bathing suit in the car.
I'm sorry?
The bathing suit in the car.
I didn't understand words she said. Ah, look how that dips right in. I like that. We're gonna get this part done, and then I'll be doing the exact same thing on the other side, so we're gonna bypass the other side, but it's the exact same thing. You notice I'm pressing down. Let me show you what I'm doing when I do that. Why the doctor should do that. What I'm doing is that, see these little holes here? Those are actual holes, right? So if I'm underneath the patient's skin into the subcutaneous fat area, when I press on, I compress the fat. It's going back and forth into the holes. So watch this. Notice I have it turned off going in. Now the machine is turned on. So I'm doing to do this. Just see what comes out of the tubing. And let's make sure we get it nice and flat. Get all that reticular dermal fat away. Hey, man, doctor. Ah, I love that. Let's work up here a little bit more. You start doing this stuff, hard to stop, because this is what I love doing. Well, chronic disease also, by the way, as well as, how do we say it, Timex, as well as medical marijuana, those things. Yeah, but this to me is fun. It brings out the artiste and doc. That's it.